Narrowing of a coronary artery can result from inadequate amount of contrast material injected with layering in the dependent portion of the vessel. Can be the consequences of spasm, which usually occurs in the proximal portion of the coronary arteries. Can be the result of focal stenosis due to a muscular bridge. Can be developmental. Can be secondary to diffuse arteriosclerotic disease in the coronary artery. The area of narrowing that we see in this right coronary artery is due to streaming, and this is due to inadequate amounts of contrast material or a slow injection, where the dependent part of the coronary artery collects contrast and simulates an area of diffuse narrowing. The next image is of the same vessel injecting more contrast material, and one can see that there is narrowing due to arteriosclerosis, but it was not as prominent as when inadequate amount of contrast was injected in the previous image. The area of narrowing that we see in this next right posterior oblique view of the right coronary artery was due to spasm, and on subsequent images the area of narrowing disappeared. In this coronary angiogram, one can see a spasm of the proximal right coronary artery, and this was documented in this individual who was a heavy smoker, and particularly women have a tendency for spastic narrowings of the coronary vessel that in the presence of associated atherosclerotic disease and with the dysfunction of the endothelial cells due to the atherosclerotic process, acute occlusions can occur that may lead to fatal arrhythmias, myocardial infarction, or sudden death. Occasionally, the coronary arteries are buried in heart muscle, and the segment that is buried is called a muscular bridge, covering the coronary artery, as we can see in these two specimens, in the epicardial portion of a branch of the left anterior descending, and in the main left anterior descending in its proximal half of the vessel. These muscular bridges constrict the artery during systole, and in diastole the lumen of the vessel reappears. This is shown in the next four coronary angiograms. The first one shows a muscular bridge affecting the proximal anterior descending branch of the left coronary artery, and this same segment opens in the view that represents the left anterior descending seen in diastole. Still, minimal narrowing persists. Of interest is that these areas of narrowing are not associated with symptoms nor with electrocardiographic abnormalities. The next three images show examples of muscular bridges, as we can see in the mid portion of the left anterior descending, picture to your left, as seen in the next image in the proximal anterior descending, in this left posterior oblique view of the coronary angiograms. And finally, the last image represents two views of a coronary angiogram with the patient in the left posterior oblique projection. The second image shows the muscular bridge. The first image to your left shows a normal appearing proximal portion of the left coronary artery. This patient happened to have occlusive disease involving the right coronary arterial tree. This is a young woman who died suddenly, and at autopsy the coronary arteries were intact, but she had an isolated stenosis just beyond the ostium of the right coronary artery. And in this next sketch, one can see the presence of intimal hyperplasia and hypertrophy beyond the origin of the coronary artery.